Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with its September 13th, 2022 update from the Dubuque County Public Health Incident Management Team. Dubuque and other counties in Iowa have fluctuated between medium and high community levels of COVID-19 since August. Right now we're at medium. Our transmission level is high, and although an indicator, this level is based on COVID tests that are reported through a clinic, healthcare provider, or Test Iowa. Since no home test kit positive cases are reported, we know the actual number of COVID-19 cases is way higher than the 91 cases we had reported here in Dubuque County in the last 7 days. One thing we do know for sure is the rate of hospitalizations and deaths due to COVID-19 has drastically decreased since last winter. This is directly attributable to a few things. Number one, immunization against COVID-19. Whether you're fully vaccinated or up to date with a booster or two, immunizations lower the severity of COVID-19 illness if you become infected. Two, we have better treatment. We have better and more effective antiviral drugs, and doctors have learned what works best to treat COVID. Three, finally, we know how COVID-19 is transmitted and what we can do to decrease that transmission, such as staying at home when you're sick and all the other guidance we've been learning since March of 2020. But let's not get too comfortable with these lower death and hospitalization rates because the actual worldwide numbers are larger than they've been due to more cases caused by the Omicron variant surges. In the last week, the U.S. lost 2,229 people. And during August 2022, we lost over 15,000 Americans due to COVID-19. Making COVID-19 the third leading cause of death. The data still shows the majority of deaths are in the unvaccinated. And on the flip side, the more vaccine doses a person has, the more they are protected from death. I don't know, that's a pretty darn good reason to get vaccinated and get the latest booster. These deaths should not be happening. So let's review where we are with vaccines and boosters. There are 4 vaccines available here in the U.S., made by Moderna, Pfizer, Novavax, and Johnson & Johnson. Some of these vaccines differ on what age groups can receive them and at what intervals. Your healthcare provider, vaccine clinic, or retail pharmacy knows who can receive what, so ask about the various options for you and your family. The big news is Moderna and Pfizer now have booster vaccines that attack the Omicron subvariants, which is what's been driving the high COVID transmission rates since last spring. Just because you may have had COVID recently doesn't mean you're necessarily immune from all the subvariants floating around out there. So if you've received your primary dose series of vaccine and you haven't had a booster for 2 months, get this new bivalent booster. The Pfizer bivalent can be given to those 12 years and older, and the Moderna to those 18 years and older. At this time, children less than 12 still receive the original vaccine. With this new bivalent booster, we're also changing what we refer to as up-to-date for COVID-19 vaccines. Up-to-date means you've completed a COVID-19 vaccine primary series and received the most recent booster dose recommended for you by CDC. And right now, that's the bivalent Moderna or Pfizer booster. Of course, those who are moderately or severely immunocompromised have different recommendations for COVID-19 vaccines. This link on the CDC website can help you figure out when you can get a booster and if you're up to date. So although case numbers are down and severity of disease is less, we're not over with this pandemic yet, and this is evidenced by our numbers and the World Health Organization continuing its declaration of a pandemic. Recently, new federal data shows life expectancy in the U.S. is now the lowest it's been since 1996, with the average American expected to live to be 76 years. This is almost 3 years lower than the average life expectancy in 2019, prior to the pandemic. The life expectancy number is highly influenced by the number of deaths, yes, deaths, in the middle age or younger population. COVID-19 significantly lowered the life expectancy due to the higher number of deaths than expected in middle and younger age people. In Dubuque County, 30 people 60 years of age and under have died since March 2020 due to COVID-19. So as the school year gets underway, we will see if our numbers are impacted, along with more activities being held indoors, school and sporting events, theater and social gatherings, class reunions, and on and on. You know what to do. Stay home if you're sick, get vaccinated, and get that new bivalent booster. And don't put others at risk. Make sure you test 5 days after an exposure or if you have symptoms. And oh yeah, one more thing. Wash your hands and cover your cough. Thanks for tuning in, everyone. Be healthy and stay safe.